Hi, this is Joel Johnson with Johnson Brunetti. Before we go over healthcare costs in retirement and how to plan for them, remember to subscribe to this channel. Make sure you hit the bell icon also so you get notified anytime we upload new retirement planning content. Now, many people don't take into consideration unexpected healthcare costs. We're all sort of worried about it. In fact, if we were to do a poll around the U.S., one of the things that comes up, probably number two after outliving my money, the things that most people are worried about, number one is outliving my money, but the second one is also healthcare. What about long-term care and so on and so forth? And here's why it's important. There was a Fidelity study, and here's what it shows. If I have a 65-year-old couple that I'm talking to who retired in 2021, guess how much they would need to cover healthcare costs? 65-year-old couple retired in 2021, what would they need? What do you think they would need to cover healthcare costs? And this is not counting insurance. This is out-of-pocket healthcare costs. And the answer, according to the Fidelity study, was $300,000. Over the course of this 65-year-old couple's lifetime, it's going to cost them $300,000 to cover health care. So obviously, this is a big expense that needs to be planned for. Now, before we get into the things that can hit you from a cost standpoint, the things you need to be thinking about, I want you to just think about that $300,000 number. Some people hear that and they get totally overwhelmed because they've just barely saved enough for retirement and they can't possibly conceive of carving out that $300,000. It might be half of what they've saved and setting it aside for healthcare costs. And if that's your situation, don't be overwhelmed by that. Just work with somebody and come up with a plan. Sometimes we look at the ideal situation, we get discouraged because we can't hit the ideal. The point is here, you take a step at a time, but we want you to recognize that these healthcare costs may be a major issue in retirement. And you've got to plan for it, and you've got to tell yourself the truth and have somebody coach you through what the strategies are if you haven't saved enough money to set aside that money in sort of an emergency fund to cover health care. Now, Medicare. We all know what Medicare is. Medicare is that thing that's sort of tied to Social Security, right? We know that at age 65, we paid into Social Security all those years, and part of that payment went to Medicare. And what does Medicare cover? Well, first of all, here's what it doesn't cover. It does not cover long-term care. So if you have to go into a nursing home, only if it's a very short stay will Medicare pay for part of it. So for instance, I'll give an example of my mom. My mom fell in her home. She had to go to the hospital. She hit her head pretty hard. They kept her in the hospital for 3 or 4 days. And then she went to a rehab facility that was a nursing home. And while she was there, Medicare paid, but they only paid because she had gone to the hospital first, and they only paid because it was a rehabilitation situation. It wasn't a long-term care stay in that nursing home. So in that case, Medicare will pay, but Medicare will not pay for long-term care in a nursing home situation or even for long-term care in your home if it doesn't involve some type of a rehab type of a situation. Now, there are different types of Medicare benefits, and this is really important. Traditional Medicare comes through the U.S. government, but you can also get what's called a Medicare Advantage plan, where you're sort of wrapping up the different combinations of Medicare in one plan, typically written by a private insurance company, and then behind the scenes, they work with the government to provide benefits. So this video right now is not about Medicare benefits. We're talking about healthcare costs in general, but it's important that you also weigh, should I have Medicare or should I have an Advantage plan? We can help you with that in our office, but again, you want to know the differences. Medicare Advantage can mean maybe no money out of pocket, but it might not be as good as Medicare where it looks like you're paying premiums for it. But understand the point of this piece is Medicare does not pay for long-term care. Now, the next point I want to make is again, if we talked about long-term care, what's the solution to long-term care? Because as you know, if you have to go into a long-term care facility, depending on where you are in the country, it could be anywhere between $7,000 a month and $20,000 a month. So think about it. If an average couple has, let's say, $750,000 saved for retirement. They're getting their Social Security. Maybe they're getting a bit of a pension, but they've got that $750,000 pot of money saved for retirement. And they've got to pay $150,000 per year for long-term care. How long will it take for that $750,000 to run out? And the long-term care benefit, if you go and get insurance, which we'll talk about in a moment, it really isn't for the person that goes into the nursing home. It's really for the person that doesn't go into the nursing home to make sure they're not completely impoverished. So what are the strategies around long-term care? If you want to fund for long-term care, if you want to plan for that huge cost that could be long-term care, which may be part of that $300,000 cost that we talked about at the beginning of this video. So there's a couple options that you have for long-term care to protect yourself. One is you can buy insurance. And I think we all know that there's long-term care insurance, but what you may not know is there's a new type that, in my opinion, is better than the old type. So here's the old type. The old type of long-term care insurance is you go out, you buy a policy, and it's extremely expensive. It might be $5,000, might be $10,000, might be $15,000 a year to cover a couple. And if you never need the long-term care, if you never go into a facility or need long-term care in your house, those premiums are just gone. Poof. They're like your homeowner's insurance or your auto insurance. If you don't have an accident in your car, you lose those auto insurance premiums. The problem is auto insurance premiums are tiny compared to long-term care. Long-term care premiums are very, very expensive. So people started looking at this and saying, well, that's really going to crimp my retirement lifestyle. Maybe I'll just take the risk. And that's not a good thing. So the new type of long-term care insurance, and we call it a hybrid, the new type of long-term care insurance, no matter what happens, you get some money back, and many times you get that money back with interest. Here's how it works. You take a deposit, or you can take a stream of payments maybe over 5 or 10 years, and you pay into a policy. And if you need long-term care, it pays back much more towards that facility than you paid in. If you never need the long-term care, and you decide you want that money back, you can cash that policy in and get all the payments you've put in back, maybe even with some interest. So if you change your mind later, you can get that money back, but you've covered the risk in the meantime. If you never go on a long-term care claim and you don't ask for money back, at your death, your family's going to get that money because it's sort of long-term care and life insurance wrapped together. Again, we can give you the details on that, but the thing to remember is it's much better than the old style of long-term care where you could pay in a lot of premiums and never get your money back. Also, you could qualify if you gift enough money to go on what we call Title 19 or Medicaid. Now, when I say that, it doesn't sound very appealing for most of you. And the reason it doesn't sound appealing is because in order to qualify for Title 19 or Medicaid, you've sort of impoverished yourself. But part of a strategy might be gifting money to kids so that you protect some of those assets, or gifting a home to children, or going to an attorney, and a good estate planning attorney will be able to protect some of those assets. So again, really important that you plan for this in the context of a full financial plan, that you understand the different planning options and so on. There's insurance, there's sophisticated estate planning, there are gifting strategies, but what we're talking about is how do you protect your assets against that huge $300,000 cost. What about home care versus nursing home? You've kind of got three benefits here. You've got home care versus nursing home, and then something called continuing care, which I'll get into in just a minute. Most private care in your home is less money than going into a nursing home. So a lot of people say, I never want to go in a nursing home. I want to stay in my home, my own home. You know, my dad passed before my mom did, and my dad passed at a time where they were just starting to look at what's called a retirement community, which had continuing care. Well, when my dad passed, my mom moved into a retirement community, and she ended up needing full nursing home care. She only lived there for a little while, and she went to full nursing home care. It would have been more ideal if she could have stayed in her own place and had that home care come in, and it probably would have been a little less expensive, but she wasn't able to do that. Either way, somebody's going to get paid, whether you're getting home care and somebody's coming and visiting you, or whether you're in a nursing home and you're paying that bill to the nursing home. So again, something that's got to be planned for, but you should have a discussion with your family about home care versus nursing home. And then I had alluded a little bit earlier to this continuing care community. So let's walk through how continuing care communities work because this can be a real good option if you have the money to do this. And I'll just talk again about my mom and dad, that their plan didn't come through because of my dad's untimely death, and my mom needed to go into the nursing home. But here was their plan had that not happened. They were going to buy into what's called a continuing care community. They write a big check. It might be for $200,000, might be for $500,000, but they write a check to, in a sense, have a house. Now, it's not their house. In a sense, they're just living in that house, but it feels like their house. They have their own beautiful condo in this retirement care community. And because they paid that lump sum, now they're paying some rent along the way, but because that paid that lump sum, no matter what level of care they need, whether it's in-home care, whether it's full-blown nursing home care, whether it's Alzheimer's care, they never have to pay more money. They never have to pay full cost for that care because they, in a sense, sort of bought that home by putting that big chunk of money on deposit. When they pass away, no matter what level of care they needed, when they pass away, their estate or their family gets a huge chunk of that money back. So here's what you're kind of doing. You're kind of taking a chunk of money, and it's almost like buying long-term care insurance, but you're not. You're putting it in a continuing care community. You get whatever level of care you need for the rest of your life, and then when you pass away, your family gets a refund of that lump sum. They're kind of using that lump sum and investing that lump sum, and they're getting the money for investing that lump sum to offset the costs of you possibly needing long-term care. A lot of different details here we've got to think about, but it's important. That $300,000 cost is absolutely huge. You've got to have a plan for long-term care. You've got to have a plan for health insurance. You've got to have a plan for Medicare and how to take it and the different options there, because you want to make sure you're not impoverished because of health care costs. If you think again about my situation, myself and Wendy, if I have to go into a nursing home, she's the one that pays the price. I'm in the nursing home. My lifestyle is the same whether I have a bunch of money, whether I'm on Medicaid or not. But she's outside that nursing home. She's worried about losing the house. Is she going to be able to travel? Is she going to be able to buy food and so on? Because what if they spend all the money that we've set aside for retirement on my nursing home care? So it's so critical. You think about healthcare context, insurance, healthcare situations in part of a financial plan. It's got to be part of an overall financial plan. Don't just pay attention to your investments alone. So many people get so hung up on making the most money they can out of investments, and they don't pay attention to the risks that they face. And again, one of the biggest risks is your healthcare costs, and especially long-term care. So thank you so much for watching this video. I really appreciate it. For more information and for all of our educational videos, make sure you hit the subscribe button and the bell icon, because when you hit the bell icon, you'll get notifications whenever we upload new content. This is Joel Johnson, Certified Financial Planner, Managing Partner for Johnson Brunetti, and I look forward to talking with you soon.